Hello, welcome Dr. Sanchez from Eurocentro Gutenberg in Malaga, Spain. Wonderful fertility clinic who are family run. And so I'm very pleased to be speaking to you today about IVF and fertility treatment for women in their later 30s. But before we speak about that, please could you introduce yourself and the clinic and explain why people come to Malaga in Spain for fertility treatment.
Hi, nice to meet you, Eloise. I'm greeting for all your followers. I recommend me for several reasons. This is pretty a nice city with good connection with UK.
And you're located right next to the beach, aren't you?
60 meters.
So people can get their vitamin D, which we don't get in the UK very often.
Okay. There is sweet temperatures in winter, but not too hot in summer.
And so fertility treatment in Spain for women who are seeking help at 37, 38 onwards, is it usually a problem?
We know that the demand of fertility treatment by women over 38 years has experienced a spectacular increase in the last 30 years. Last years in our clinic, 45% of IVF cycle with own eggs, and the 85% of donation were performing in women over 38 years. Okay, the average rate in Spain of the women to bear their first child is 30 years old, and the 7% of total births occurs in women over 39 years. And it's logical because there is an important increase of the life expectancy, and the most of these women have a good health. This may feel them that they can get pregnant easily and without problems. But unfortunately, in the most of cases, it's not true.
So how long would you expect a couple with a woman who is over 37 to try to conceive naturally before seeking fertility help?
We can talk about a fertility problem after 1 year with normal relation without successful. Very important negative impact of the women age, the fertility. 6 months, okay, we can consider that enough time to conceive naturally. If there is no pregnancy, we think that it's important to start the diagnosis process and try to improve the fertility with any fertility treatment.
And women who are of a more advanced maternal age, what should they expect in terms of the types of fertility treatment and the success rates?
According to the fertility Spanish law, reproduction techniques may only be carried out when there is a reasonable possibility of success and not a serious risk for complication in mother or her offspring. What means a reasonable possibility of success is complicated.
And is there anything that people can do themselves to improve egg quality?
There is little that we can do. Most useful thing is follow a healthy lifestyle to delay as possible the ovarian aging. The ovarian aging is a natural process that affects all women, but can be accelerated or delayed for several factors. And one of the most important factors is that we call oxidative stress, produce a severe damage regarding the ovarian reserve. And it's produced by an excess of free oxidative radicals or a reduced number of antioxidants. And it's related with unhealthy habits. For this, several recommendations have been proposed to try to reduce the negative impact of this problem. And finally, has proposed the use of antioxidant supplements. It's very common. Several antioxidant supplements has been proposed, inositol, vitamin D or E, but probably the most interesting is the coenzyme Q10. The coenzyme Q10 increases the production of energy by the mitochondria. And this is something very important for the meiosis process. There is an experimental life-on investigation regarding the mitochondrial transplantation that consists in the transfer of mitochondria inside the eggs during the ICSI moment to provide more energy to the eggs.
We hear a lot, don't we, that the Mediterranean diet is very good for fertility. And I guess that's another great reason to have treatment in Spain, for example.
Mediterranean food is excellent to provide all the antioxidants and other beneficial nutrients, fish, more than meat, and in concrete.
How long would you suggest that a patient tries with their own eggs before looking at egg donation?
Make the decisions if we're recommending egg donation of is possible performing an IVF cycle with own eggs is stressful for the professional. We need to analyze several factors, but especially two, the age of women and her ovarian reserve. We know the most prominent factor who affecting to the success in IVF is the age of the women. Over 44 years, the chance to achieve a healthy pregnancy is so low that our recommendation will need them performing IVF and consider alternatives like egg donation. But in women or in cases with a special number of facts and with an important patient desire to achieve a pregnancy with all eggs, there is a possibility to contemplate do the IVF process, but including these good conditions, the chance to achieve the pregnancy is very low. Mm-hmm. The guess limitation to achieve IVF is the age of women. But in egg donation, obviously it's different because the live birth rate are excellent and don't depend for the women age. The only limitation to performing this is ethical consideration, the higher risks of pregnancy complication related with advanced maternal age, like prematurity, low birth rate, preeclampsia or diabetes. In Spain, there is not a mandatory legal limit to performing the fertility treatment, but there is a general agreement to establish the upper limit in 50 years.
The Spanish egg donors are all anonymous. People cannot know their identity.
Oh, yes, of course. Of course.
What are the success rates for women in their later 30s and early 40s with IVF with their own eggs versus IVF with donor eggs? What's the difference in success rate?
Very different regarding the age that we perform the IVF with own eggs. For example, our outcomes in IVF for women with more than 38 years in the last 5 years show us a cumulative pregnancy rate per patient of 39%. But if we analyze these results year by year of phase, we can see that are very different. For women with 39 and 40 years, the cumulative pregnancy rate per patient was 45% and a miscarriage rate of 12%. But in women with 41, 42 years, the cumulative pregnancy rate down until 31%, and the miscarriage rate increased until 31%. In women with 33 and 44 years, the pregnancy rate down until 17%, and the miscarriage rate rose until 57%. That means a live birth rate between 7-8% for women with 43, 44 years. But over 45, the chances are minimal. This result show us the enormous impact of the aged women in IVF with ONS. But what's happened with egg donation? It's absolutely different. The live birth rate with egg donation are excellent, okay, around 60% per embryo transfer, regardless the age, are the same in women with 40 years, 45 years, or 47 years. For this, if we compare the results in IVF with own eggs, in women with 38, 39 years are very acceptable. Mm-hmm. But the problem is that the pregnancy life rate decreases gradually.
And for women who are using egg donation and they are older, does the miscarriage rate reduce versus their own eggs?
When we consider the egg donation, we not only can talk about an increased pregnancy rate. The most important thing is that increase the live birth rate. Yes. And that means that the miscarriage rate is very low, okay? According to between 11-30%. It's very similar to the young population.
Can you explain why the miscarriage rate is lower using egg donation? Is it because the eggs are from younger women?
When we talk about the problems in the women's fertility with advanced age, it's related with the ovarian aging. And the ovarian aging comes with an irreversible, a progressive deterioration of both quantity and quality eggs, and increase number of eggs with abnormal number of chromosomes, as to say, with aneuploidy. This, the advanced age, not only reduce the fecundability, also increase the risk or miscarriage. The problem is the high rate of eggs with aneuploidy. In young women, the rate or the percentage of eggs with aneuploidy is much less. Women with 30 years have around 30-35% of eggs with aneuploidy. But in a woman with 41 years, the rate of eggs with aneuploidy will have around 70%. And this rate increase in more advanced age. Probably over the 44 years, the most of eggs will have aneuploidy.
And Dr. Sanchez, last thing, do you have any final considerations or thoughts for anyone who is starting to look at treatment in their later 30s or early 40s? What would be your takeaway piece of advice?
Always need to consider her desire. We think that is very important. Understand that the women can try to achieve a pregnancy with own eggs. It's important for us that the patients have an active participation in the process to determine what is the best therapeutic option. On the other hand, it's very important to do a study, a personal study of every case, and provides the most objective and complete information about the prognosis. Patients need to know what is the real efficacy of every reproduction technique, what is the real chance, and their live rate. But resume to decide when a case is acceptable to consider IVF, I think that women between 38-41 years is not necessarily an excellent conditions for ovarian reserve to achieve a pregnancy in IVF, but in the group of women between 42-44 years, the effectiveness of the IVF is very reduced if the women have not a good number of follicles available to improve the results. Women with 44, 43 years, 44, probably our recommendation will be that do IVF is worth it if her ovarian reserve is good. If the levels, if the parameters of ovarian reserve is to reduce, maybe our recommendation will be that egg donation is the best therapeutic option. But I think that always is important, make a consensual decision with the patients about the best option.
Lots of consideration. So thank you. And the last thing to say is, if people want to speak to Dr. Sanchez or any of your wonderful team, family-run team, you overlook the beach in beautiful Malaga, Spain, and you offer free online consultations. So for anyone who's in the UK or in Europe or anywhere who would like to speak to the team, then please click on the link here and you will be able to contact them. Thank you so much for your time today, Dr. Sanchez, and it's been great talking to you.